everyone, welcome to the 1000 MCQ series of Pharmacist, Analyst and Drug Inspector Examination. This is our exclusive course for Kerala PSC Analyst Grade 3 Examination. So let's get ready to crack this exam. Starting with the first question of the day, which of the following is phenyl triazine derivative? Is it zonisamide, lamotrigine, felbamate or tiagabine? Yes, let's see the structure of these compounds. So this is phenyl triazine, right? Now, which drug is having similarity towards phenyl triazine? Yes, as we can see here, lamotrigine. The structure of lamotrigine is having similarity to phenyl triazine, right? So, what will the answer for this question? It will be lamotrigine. Coming to the next question. Who is considered as the father of surgery? Right? Is it Dioscorides, Galen, Aristotle or Shushruta? The father of surgery is considered as Shushruta. He is an Indian physician who wrote the book Shushruta Samhita. Right? Now, his work or his book details about various surgical procedures including rhinoplasty, cataract surgery and bone setting. The father of surgery is considered as Sushruta. Coming to the next question. Which wavelength of the UV light provides maximum germicidal action? Is it 253.7 nanometer, 275.5 nanometer, 283.5 nanometer or 240 nanometers? The UV light with maximum germicidal effect is 253.7 nanometers. So in this particular range, it is having strong disinfectant properties as well as kill or inactivate microorganism. How it does that? By damaging the genetic material, that is the DNA or the RNA of that microorganism. So the correct answer for this question is 253.7 nanometers. Now coming to the next question. Non-linear pharmacokinetics can be expected due to, it can be due to enzyme induction or it can be due to active secretion. Which is the correct answer? Yes, they have marked this as P and this as Q. So both P and Q are true. P is true, Q is false. P is true, Q is true, P is false, or both P and Q are false. Yes? So here they have given enzyme induction as well as active secretion. So this non-linear pharmacokinetic can occur due to both these conditions, that is enzyme induction and active secretion. So in enzyme induction, what happens is that there can be increase in the metabolism of this drug. This can lead to non-linear pharmacokinetics. Right. Now coming to active secretion, what will happen? When the transport is saturated. When saturation of transport takes place, it can lead to non-linear pharmacokinetics. So the correct answer for this question will be both Q and A are true. In both conditions, enzyme induction and active secretion, it can lead to non-linear pharmacokinetics. Coming to the next question, which of the following routes of administration of drug is associated with phlebitis? Now, is it subcutaneous, intravenous, intraspinal or intradural? We know that this particular condition is taking place in veins when we are administering IV. Whenever we are inserting IV catheters or infusion or anything, it can lead to irritation of the vein. Now, this irritation of the vein, as you can see in this picture, it can lead to conditions such as phlebitis. Now, what will the correct answer for this question? It is IV or intravenous route of administration. Now, coming to the next question. Upon standing some time, gel system shrinks a bit and a little liquid is pressed out. Now, what is this phenomena called? Is it oozing, syneresis, shrinking or desolvation? Now, whenever a gel system, from a gel system, liquid is coming out, it is known as syneresis. Now, it can be due to various factors. What are the factors? It can be due to change in the temperature, change in the pH or change in the ionic strength. Now, this can occur in various types of gels such as gelatin, gels made up of gelatin or gels that are made by using hydrocolloids. So this will lead to oozing out of this liquid. The phenomena or this condition is known as syneresis. All of the following are indications for the use of ACE inhibitors except for one. Now identify that. ACE inhibitors can be used for hypertension or myocardial infarction, left ventricular dysfunction or pheochromocytoma. Now in which condition ACE inhibitors cannot be used? Now which is the condition? ACE inhibitors can be used in hypertension, myocardial infarction and left ventricular dysfunction. But in pheochromocytoma, that is in the tumor of the adrenal gland, if we use ACE inhibitors, it can lead to higher blood pressure. So commonly in this particular condition, ACE inhibitors are not used or not indicated. So what will the correct answer for this question? It is pheochromocytoma. Coming to the next question, which one of the following is a beta-lactamase inhibitors? Now, beta-lactamase, we know it is an enzyme. So, is it penicillinic acid, boric acid, cephalosporinic acid or clavulanic acid? Right, it is a very easy question. Clavulanic acid is the answer. This is beta-lactamase inhibitors. So, we are giving this along with additional like penicillin-like derivatives so as to protect that particular drug from degradation by certain bacteria. Right. So this is clavulanic, the structure of clavulanic acid, which protect our drug from the enzyme produced by bacteria. Which is the enzyme? That is beta-lactamase. So what will the answer for this question? It is clavulanic acid. Coming to the next question. Mifepristone and gemiprost combination is used for medical termination of pregnancy. The action is caused due to which of the following mechanism? Mifepristone is an anti-estrogen while gemiprost is a progesterone E receptor agonist. Or mifepristone is an anti-progesterone while gemiprost is a prostaglandin E receptor agonist. Or mifepristone is an anti-androgen while gemiprostone is a prostaglandin E agonist. Mifepristone is an anti-progesterone while gemiprostone is a prostaglandin E antagonist. Right. So here they have given two drugs, that is mifepristone, gemiprostone, and the combination is applied here for this options. So how are we going to answer this question? Let's see. Mifepristone. What will mifepristone do? It will block the action of progesterone. So this progesterone is very much important for maintaining the pregnancy. Now when the action of progesterone is blocked, this will lead to termination of pregnancy. Now coming to gemiprost. What is gemiprost? It is a prostaglandin E1 analog, which means it will act or it will be an agonist to prostaglandin E1. Right. So what will this cause? It will cause uterine contraction and soften the cervix. Now this will also lead to expulsion of the pregnancy tissue. Combination of this is used for the termination of pregnancy. So what is the correct option? Mifepristone is an anti-progesterone while gemiprostone is a prostaglandin E agonist. Now, coming to the next question. A 60-year-old woman with a history of type 2 diabetes is diagnosed with heart failure. Which of the following would be a poor choice in controlling her diabetes? Let's see. Is it metformin, pioglitazole, glipizide or exenatide? Now, here we know pioglitazole. This particular drug can increase the risk of heart failure. So this will be a poor choice. Metformin can be taken only in patients if we are having severe renal dysfunction. Then only we will consider or rethink whether to give metformin or not. Now, glipizide it is also given for type 2 diabetes, but the main risk is in elderly patients, especially there is a risk of hypoglycemia. Now, exenatide is a GLP-1 receptor agonist, which is normally considered to be safe. So, what will be the answer for this particular question? It will be pioglitazole. This is an exclusive course for ANALYST Grade 3 examination. So, let's get ready to crack this exam. Hope you enjoy the video. Thank you.